time to stay connected on all the important events that are happening here in North Dakota. We've got a lot of ground to cover today, so I'm going to get right into the numbers, and we've got a lot of good news today. First piece of good news on the numbers is we completed record number of tests yesterday. Today, the North Dakota Department of Health confirmed 40 additional cases statewide, COVID-19. Out of 2,894 tests conducted, that beats the previous state record of 2,861 tests set on May 15th. Today's positive rate, then, of those, 40 out of the 2,894, 1.4% positive rate among all North Dakota tests completed. That's the lowest daily positive rate we've seen since May 17th, and the lowest daily positive rate we've seen since we've really started focusing in our testing on those that we believe have been in potentially high contact situations. So to be doing more targeted testing, and having a lower positive test rate, fantastic news. We've completed now closing in on 90,000 total tests, 89,599 tests in North Dakota. In North Dakota of North Dakotans, because there is some testing that's done of people that are residents of Minnesota or South Dakota or Montana. Those are have never been included in our numbers. So people with North Dakota addresses, of those almost 90,000 tests that have been completed by our labs and our lab partners, that includes 69,453 unique North Dakotans have resulted and we've had 20 positive cases, but now we're closing in on 70,000 North Dakotans know what it's like to have a COVID test taken. Another shared experience from this pandemic. At this rate, we're going to pass 100,000 total tests taken next week, and we've now tested over 9% of our population. There's only 3 states in the nation that have tested over 9% of their population, and again, that's a credit to our state lab in partnership with all the local public health units and the private health care providers across the state, and of course in partnership with all of you who've come forward to get tested. This capability that we have around testing, we've talked about it a lot and why we do it, and we do it because of course when we can identify where the cases are, we can trace those, finds out who's been exposed, and then we can isolate those individuals. This is key to allowing us to getting our economy back on track and opening up. As all of you know, we shut down less than other states. We're on track to open up faster, and our testing capability is going to be one of the tools that we have that allows us to do this safely while we're going through there again. So thanks to everybody who's been involved in the testing efforts and the contact tracing efforts at both the state and the local levels, and our providers, because the capability that we're building here is what gives us confidence to keep adding more risk of potential transmissible moments back into our economy. When we take a look at serial testing, again, this concept we've introduced recently, in the gray on the bottom of this slide represents people that are new on that day, people that have been never tested before. So in today's results, 1,199, one short of 1,200 North Dakotans had their first test, but of the tests conducted, 1,695 were repeats. And again, a lot of those are individuals that work in high-risk areas, particularly healthcare workers, or that work or live in high-risk areas. So that could be healthcare workers or perhaps people in long-term care. When we take a look at the net case breakdown of the 40 new cases, but also 89 that were newly recovered, we're now back under 600, 579 active confirmed cases, and of course we've had lots of people recover, 1,882 recoveries, and sadly 59 deaths, including 2 additional deaths of individuals who passed away with COVID-19. One was a woman in her 90s from Cass County. Another was a man in his 70s from Cass County, and both of those individuals had underlying health conditions. And as always, our thoughts and prayers go out to the loved ones of of those individuals who just passed recently, as well as all of those who've been lost through this COVID-19 pandemic. Currently, there's 36 people who are hospitalized. This is down from our peak point earlier this week was 41, I believe, but this is still only about 2% of our total hospital capacity, and only a subset of those 36 are in ICU. We have lots of adequate, not just adequate, we've got a lot of great hospital capacity in North Dakota and a lot of great providers in North Dakota, and it's always been something that we were doing a lot of this action for, was to make sure that we preserved that hospital capacity, and we've done a great job of that here in North Dakota, and again, that gives us confidence to keep going forward in terms of helping get our economy going even stronger. When we take a look at the breakdown of focused effort in Cass County, we know that of the active cases that are in North Dakota, which are back down to 579, 443 of those are in Cass County, and of course this means that there's a higher percentage of cases per population there than in other parts of the state. And when we take a look at the 14-day rolling average for the state of North Dakota, it's 2.6. The Cass County 6.6 deaths. 48 out of the 59 deaths in North Dakota have happened in Cass County, and of course those, as was expected, those deaths coming from people that had underlying health conditions or were elderly, or both of those cases. When we take a look at the actual population of cases, let's take a look at the rate and compare the two. North Dakota remaining flat. They're at slightly down at 2.6%. This is the positive rate of completed tests divided by the tests that were taken over the last 14 days. Cass County also on a nice downward trend at 6.6%, and while that is higher than the state average, people can remember back to May 1st when we opened up the economy. That's about where the state was at about 6% when we started to reopen on May 1st, those portions of the economy that had been closed. So with that, we want to talk a little bit about North Dakota Smart Restart. We described, if we take a look at the chart that we introduced on May 15th, it had 5 levels. Critical in the deep red, which we were never in, thankfully, in North Dakota. Other states were in there and stayed in there a long time. We were in a high level is what we started out initially. When we introduced this scale back on May 15th, we made a determination based on a number of criteria that the entire state was in the moderate, or that yellow level across the state, and we want to, and again, just be grateful to all of you and all the work that were done here, that we were never at that red level. When we looked at the guidelines that we have under Executive Order 2020-06.7, these are strictly guidelines, and so there's a set of guidelines generally for businesses and for specific industries that relate. So when we move from one risk level to another, it triggers a change in all those guidelines. And after thoughtful consideration and inputs from health professionals and from the business sector, as we work to try to save lives and livelihoods, we're making the announcement today, a significant announcement that we as a state are moving the entire state to green from moderate. And so with that, we're moving into what we call the low risk area. Again, to be able to do this, I just want to say again, thank you to the people of North Dakota, because it's your actions, your individual responsibility, which has produced the great data, the low numbers, the low cases, the low utilization of hospital, the low spread, the fast responses, the collaboration. I mean, all of that is what's happened here again. And I'd say that when we talk about North Dakota Smart, North Dakota's been very smart to date, and that goes back to all of you. When we when people will ask about the timing of this, what does this mean for businesses? You should go to the ndresponse.gov, take a look at the guidelines that are specific to your industry, take a look at the ones that are general for everyone, and then as you feel that you can meet those guidelines, feel free to move to the next phase of reopening when you're ready to do that and when you know that you can take care of your team members and your customers in a way where you can keep them safe. People might say, why now? There's a number of reasons of why we felt now was the time to move to the green level statewide. The high testing rate, again, when you've got more data, you can be more confident. This 9% of the entire state that's been tested, and then a big portion of those have been tested more than once, and we've got our testing capacity that's growing with new machines coming on at the state lab and new partnerships. We feel very confident about our ability to have good data going forward. Key criteria was adequate number of hospital beds and ICU capability, and again, that capacity our ability to deliver care at the highest level for those in the most need. And at no point have we had more than 2% of the hospital capacity in our state going towards COVID, which is great. And then in terms of actual, low rate of active cases, even when we take a look at this number of cases now dropping below 600, that is 0.08% of the population. And we've also had a very low positivity rate the entire time. We were, often in the top 5 or the states for the lowest positivity rate. We've climbed up a little bit. I think because of the great job that we're doing on our targeted testing, we've moved up a little bit, but that gives us a sense of the strength of our capability, that we're a state that's trying to find positive cases and isolate them. We're not trying to artificially drive our rate low. And again, great exercising of the personal responsibility and great work on the North Dakota SMART protocols and guidelines. Also, just on the fatality rate, 2.3% of the cases in North Dakota have resulted in death, and that is one of the lowest rates in the country. And again, I put that back on the strength of North Dakotans as individuals, but also on our ability to deliver care at the highest level. We did take a look. We've got the chart up here with all counties looking green. We did take a look at this at a county by county level, and of course we had some counties that already have very low population density, which has allowed for great social distancing since statehood. We have had, so they were ready to go when the pandemic hit. We've had 20 counties that right now would meet all 11 gating criteria to go to green. We have there's 11 criteria. 52 of the 53 counties meet 7 or more. Cass County was the only one that didn't meet 7 or more. But again, when we took a look at Cass County, there's only 0.25% of the population of Cass County right now has an active case, and because of our contact tracing, we know where those folks are. If they worked in long-term care, and were positive, they're at home and in isolation. If they're positive, if they're in a hospital, we know where they are, and if they're positive, and if they're in a long-term care facility as a resident, they're in isolation from other people in there. So again, we have a very small, again, I'll repeat, 0.25% of the population of Fargo right now is an active case, and again, high confidence that we know where those individuals are. So again, as part of our ability to decide to reopen the entire state today is also, again, I want to give a shout out to the mayors of Fargo and West Fargo and the Cass County Commission and their leadership and the Cass Clay efforts, the Red River Valley COVID Task Force, as we're calling it. Because of that, I would say we know more and have more granularity in terms of what's going on the ground in Cass than we do in almost any other county in the state, because of the energy, the time, the resources, the people, and the contact tracing, the targeted testing that's been going on there. And again, that gives us the confidence that we can go to green for the whole state. Under the protocols, the North Dakota, there's what we call the universal protocols, include the most recent CDC guidance. And so again, we're updating what we have posted online as CDC guidance changes, and that includes best practices, and they're highly recommended for all industries and activities to follow. So whether you're a park board or a fitness center or a manufacturer or a church, I mean, there are things in there that apply to everyone in terms of the North Dakota SMART guidelines under the universal protocols. Also, there are industry-specific standards. Those have been revised based on the task force that we set up through the North Dakota SMART Restart, and they've got a lot of private sector input. And changes include providing additional context and consistent language to help ensure clarity for those that are looking to follow those recommendations and guidelines. I'll just give you a few of those. In the personal care area, again, where face masks were originally required for some services and not for others, it's now strongly recommended that face masks are used for services that last more than 10 minutes. In the restaurant, bar, and banquet guidelines, language now specifies that food service for takeout at grocery stores, convenience stores, and other outlets should follow the same guidelines and protocols and customer self-service guidance that were similar to buffets, salad bars, and beverage stations that were applied to restaurants. So again, we can be consistently safe across all forms of food service. And then each of these now have been updated to include specific recommendations for each risk level. So again, whether you're in the restaurant, large gathering, whatever business you are, North Dakota ndresponse.gov, go in there and take a look at the North Dakota SMART Restart risk levels, go underneath there and you can find out specific things for your industry. For example, I think one thing that people have been asking a lot about is yellow. We were at yellow risk level, which is where we were till 15 minutes ago. We were at 50% capacity for restaurants. This opens up the ability to go to 75% capacity when the restaurants feel they can meet the guidelines. So again, go read the guidelines, and if you feel that you can meet the guidelines that are in there, you've got the ability to go to 75%. And so on and so on. Again, there's like under, hair salons, medi-spas, massage therapy. Under yellow, walk-ins were not recommended, but green states that businesses in the personal care businesses can utilize appointment systems. They're encouraged to utilize appointment systems, and unless a walk-in system can be used safely. But again, these are all recommendations. There's a number of recommendations for fitness centers, playgrounds, etc. Movie theaters, yellow was at 20%, green opens up capacity to 65. For gatherings, again, for event space, yellow we were at 50%, green opens up capacity to 75. And for places where you might have been alternating rows, chairs, or bleachers, green allows for consideration of not requiring alternative rows. Banquets and weddings, green opens up capacity up to 75% of a facility and up to 500 attendees. For people that have June weddings coming up or large events, that will be an important one to note. But again, lots and lots of detail. ndresponse.gov. Universal protocols for everyone, industry specific. Go check it out. And again, let's continue to be North Dakota SMART as we move to the next level, the low level. Next up, another important topic that we've had under consideration is, how do we re-engage and safely allow to be able to have visitors get into our 218 long-term care facilities. We know that as we've talked about at every one of these briefings, we've talked about the importance of mental health and the connection to physical health. We know that contact with loved ones and that support network and physical touch, well, there's been a lot of that's happened electronically. Nothing can replace the actual being with our loved ones. This is something that we're working very hard on. From a call with about 20 governors last night, I know that across the nation, this is something that every state is working on. No one's got an easy answer, because this is where we've got high rates of risk and high rates of risk for individuals, so we want to proceed with care. But we've got great collaboration across industry and residents working together on a plan. And of course, Chris Jones, who's leading our vulnerable protection plan, the VP3 plan, has been taking the lead on this with his team, and he's going to come up and speak to what our plans are looking forward to how to begin down a path towards reopening up our facilities. Chris, thanks for being here.
Thank you, Governor. Skilled nursing, basic care, and assisted living residents across North Dakota have faced great impacts as a direct result of COVID-19. Nonetheless, the time has come to start conversations regarding the gating criteria necessary for relaxing restrictions while also mitigating the risk of resurgence. As of this week, all skilled nursing, basic care, and assisted living facilities have completed an initial round of testing and/or serial testing of residents and staff. North Dakota has utilized its testing resources to develop the data necessary, as the governor has talked multiple times about, to pave the way and be a national leader in reopening congregate living settings. We've started to develop guidance for reopening in conjunction with the recommendation outlined by CMS, the Centers for Medicare and Medicaid Services, and the North Dakota Smart Restart Plan. The guidance will be individualized to ensure that a safe, resident-centered, evidence-based decision governs the reopening of facilities where our state's most vulnerable populations reside. Collaboration with key stakeholders was instrumental in developing this framework, including input from the Reuniting Families Task Force, which is chaired by Chris Larson, who's a resident of Luther Memorial Homes in Mayville, the Long-Term Care Association, legislators, the North Dakota Department of Human Services, the VP3 team, as well as the North Dakota Department of Health. We will use a phased strategy approach to gradually relax restrictions in skilled nursing, basic care, and assisted living facilities. Initially, all facilities will have to undergo a minimum of 2 rounds of testing among both residents and staff with a 90% compliance rate in order to meet gating criteria for entrance into the 3 reopening phases. Items that will be evaluated when determining whether a facility can move to the next level of our phased reopening approach includes the county's case status on the color-coded health guidance system, the case status of COVID-19 positive residents within the facility, staffing, access to adequate testing, ability to screen all residents, visitors, vendors, ensuring adequate PPE, local hospital capacity, and results of continued serial testing among both residents and staff. When we begin to lift restrictions, we'll start inside the facility first, for instance, areas like communal dining and group activities, and then evolve to external components such as outings outside of the facility, non-medical appointments in phases 2 and 3. Visitation for all residents will initially occur via scheduled outside visits while adhering to universal source control measures, meaning social distancing, donning of a surgical mask or wearing a surgical mask, and appropriate hand hygiene. As facilities progress through the phases, visitation will be opened internally under established thresholds and with restricted movement to mitigate potential spread of COVID-19. All skilled nursing, basic care, and assisted living facilities across North Dakota are currently considered to be in the highest level of vigilance, or yellow. Prior to any advancement in these phases, each facility will collaborate with the VP3 task force to review that gating criteria for advancement. Facilities will also be given the flexibility and discretion to adopt more stringent guidelines if they so choose. I think a very important point, because I know everyone is excited to visit loved ones, but families will be notified by each facility when criteria have been met and provided with dates for when changes will be occurring to their individual visitation and service guidance. Thank you.
Thank you, and Chris will be available for questions. And again, just for clarity, as part of our presentation today. When we're going to green, we're talking about the economic side of reopening. What Chris was talking about in terms of sort of the highest level, we've got the green does not apply to congregate living, does not apply to shelters, domestic, homeless, doesn't apply to long-term care, does not apply, whatever. Those are under the VP3 plan, and so stay tuned, listen to Chris about the gated and phased reopening for that. And my remarks relative to the green had to do with commercial enterprises that are listed under the North Dakota Smart Restart. So we'll be clear about that. We want to make sure that we're protecting the most vulnerable, even as we add more risk of potential transmission through more contact back into the economy. But thank you, Chris, for being here. And again, we'll be available for questions. I also want to read a brief statement today. Chris Jones mentioned Chris Larson. Chris, who is a resident of a long-term care facility but works from there. He chairs the Reuniting Families Task Force, and so this is a quote from Chris Larson. He says, "While our work is far from complete, the first step is key in the end goal of reuniting our residents and families at the end of this pandemic. Our committee is geared towards perfecting these guidelines. It is our hope to still have the final policy developed by our June 25th internal deadline. It is with that support here today that we move even closer to that deadline." And so again, this is the Reuniting Families Task Force that's working in conjunction with Chris Jones. But thank you, Chris Larson. Thanks to everybody on that task force. Thanks for making sure that residents have a voice in this discussion. Next, we got a couple of quick updates related to questions that we had on Wednesday. One question on Wednesday was related to antibody testing. And antibody testing, also sometimes called serology testing, is a blood test that can look for antibodies of COVID-19 in the blood to determine if an individual has been infected, even if that person never showed any symptoms. And when we say blood tests, there's two different kinds of blood tests. One can be a finger prick, which people are probably familiar with, where a little bit of blood comes off your end of your finger and then goes on to a lateral flow test. This can be quick. You can have the results in 15 minutes. It's less accuracy, but it can tell you whether or not antibodies may have been developed by you in your bloodstream as a result of being exposed to the COVID virus. The second is a full blood draw, which then like a medical blood draw, that blood draw then would go to a lab, and that is a more complex, but it's also more accurate test that can be run. In the past 2 months, the state has purchased a total of 178,000 point of care serology tests. These are the quick, easy finger prick point of care, 15-minute result type tests. The state lab and representatives from the physician advisory group looked into many options for tests. They worked with OMB. They vetted purchases for price, specificity, time of arrival, worked with our procurement process here as well. So thanks to the team for working through that to make sure we got a test of high quality at a good price. The state's received 101,000 of those tests. 77,000 tests will arrive over the next few months. So then you're saying, what's the plan with that? Well, the plan right now is to work on really validating these tests and gaining confidence so that when we do use them, we can get data. Dr. Andrew Stahl, who on Wednesday was named as our interim state health officer, prior to this, he'd been working as part of our testing team, and he serves on the North Dakota National Guard's COVID-19 task force. He was already in the process of working on validating these serology tests for accuracy, and one of the ways that we do that is we go back into places in North Dakota where we know that we've had high levels of positives. So if you think about places where we've had outbreaks, in counties like either Cass County or Grand Forks, we would go back to those individuals who have recovered, ask them if they would be willing, people who've tested positive, we know they were positive, we know they've recovered, to go to them and say, would you be willing to participate in a study? where we would do the finger prick, blood test, and then to see if those people who had tested positive early then also show up on these point of care tests. In addition to the point of care test, the public health lab also has the ability to screen for IgG antibodies using two different machines. One is the Abbott Architect I-1000 and also the Diasorin Liaison. These machines are very accurate. They're used by healthcare facilities to see an individual's had a past COVID-19 infection. And again, but these require a full blood draw. The more time that goes by, the more valuable data we likely the more data we'll have. And to date, of those 177,000, 2,632 serology tests have been completed, either in private labs or at the state lab. And of those, only 86 have shown that antibodies were present. And these are not counted in the daily testing results that we give, because the tests that we're announcing now are the diagnostic tests. Serology does not tell you right now whether you're positive or negative. It tells you whether you were exposed to it and you developed antibodies to that. And so we will start posting those results separately at health.nd.gov coronavirus, so those will be out there, but again, we're currently not counting those in our testing numbers. And to be most effective, these tests need to be deployed at the right time in the right place. As we complete and work through more studies to validate the point of care test, the 177,000 we have, then we'll be able to deploy them to populations where we can provide the most insight into the reach or disease or how it might have impacted a community. And some of this will happen with individuals, but some of it may be with outreach with businesses. For example, we may work in conjunction with the private sector to test an entire manufacturing plant, for example, to find out how many people may have had it. This can help us develop scenarios and understanding around how much herd immunity may exist in our state. Okay, that's the update from that question. We had another question on Wednesday, so quick update on CARE-19. As we've previously announced, the CARE-19 Exposure app is the new app which will make North Dakota one of the first states in the nation to utilize the Bluetooth capability that's being developed by Apple and Google. And again, this is all anonymous, all confidential, but it would give you an alert if you had had potential exposure. The team is making good progress on the project, and of course working very closely with Apple and Google. And the plan is to release the Android and iOS version of the CARE-19 Exposure app either at the same time or within a few days of each other. Do not have a release date to share yet today. And we'll have a more finalized release date soon. Until then, CARE-19 app, which we've talked about, which is being renamed CARE-19 Diary, still available through the App Store and on Google Play, and is a very helpful memory aid should you find yourself in a conversation with a contact tracer. And of course, with CARE-19 Diary, as we've discussed in the past, there is no personal data that's collected by that, and it's only an anonymous 32-digit number, and so there's no data to be shared. And if you do get contacted by a contact tracer, it's up to you to decide if you verbally want to share that information. And of course, you're in control. You can delete the app, delete the data anytime you want. But when you're being asked by someone, where all have you been in the last 10 to 14 days and who might you have been in contact with, having that reminder could be very helpful and help you, again, stop the spread of the virus. Next topic is state facilities. We talked about how they're reopening next Monday, but this is both a shout out, some gratitude, but also some coaching for people that are trying to get services across the state. Again, we're opening up under the North Dakota Smart Restart guidelines on June 1, agencies and supervisors. So if you're a team member for Team ND, talk to your supervisor, because they may have already let you know who's going to be coming back, who's going to be continuing to work from home. The target is to be at about 50% occupancy. Public-facing roles will be returning to work on site. Other members will continue serving in a remote workplace setting. Public tours of the Capitol building remain suspended until further notice, and all individuals entering the state capitol or other state facilities may be subject to wellness screenings. We encourage all citizens to seek online options to services when possible. And if in-person services are needed, remind you to continue to follow the North Dakota SMART and CDC guidelines. Question has come up about NDDOT. Those services are all available, but they're going to remain by appointment only. Even though the building is open on Monday, they're still not going to be accepting walk-in services. This is again for both you, the citizen, and for the staff here to make sure that we don't end up with large groups in waiting rooms. Appointments can be scheduled ahead of time by visiting dot.nd.gov, and so you can schedule that visit electronically through an online form, or if you'd prefer to call, you can call 1-855-633-6835. We want to ensure that we're continuing to provide effective service and safe for you and safe for the team members. Appointments certainly help in that effort, and they certainly save you some time as well to avoid wait times. The North Dakota DOT Smart Reset program was implemented on May 11th. Over the past couple of weeks, just in the part of May here, 3,147 driver's tests have been completed. Those are in-person driver's tests. Nearly 4,000 driver license appointments have occurred. 49,500 motor vehicle transactions have occurred. And when we say call DOT, we know we're an auto-centric society still, because DOT just in the last weeks has fielded 34,000 phone calls. So again, executive orders are still in place. So if you've got a driver's license or a registration that is expired after March 1, that is still valid. So you don't have to rush out on Monday morning to get that changed. We'll give you plenty of heads up when that executive order is going to expire, but you're still okay if those have expired after March 1. And again, if you do need if your driver's license or tabs expired prior to March 1, you do need to renew. So again, dot.nd.gov, get an appointment, online form, or call 1-855-633-6835. We're here to serve you. And again, thanks to everybody at DOT who's adopted to this new approach, and again, working to make sure it's even more efficient for you, our citizens. Under the good news section today, we've got lots of good news. And today's good news relates to this coming weekend's double graduation. We know that across 175 school districts across the state, there was a lot of innovative and creative and fun, I'll bet different approaches to graduation, but I think nearly now, or at least by the end of this weekend, all of the 8,053 North Dakota seniors will have graduated in perhaps the most memorable spring semester ever. Not exactly what they might have planned for or hoped for, but they'll have certainly memories that they'll remember for a lifetime. Superintendent Basil and I are honored to participate tomorrow in the statewide virtual graduation, which is happening. So Saturday, May 30th at 2 p.m. Central Standard Time, 1 p.m. that'd be Central Daylight Time, 1 p.m. Mountain Daylight Time. We've got the high school graduation commencement address being delivered by none other than Carson Wentz, and other speakers will include Josh Duhamel, the Nashville hit music duo of the sisters from Tiger Lily, and also 5 North Dakota seniors. So again, congratulations to those seniors who are representing the 2020 class of North Dakota high school seniors. Courtney Bitts from Napoleon High School, Kane Kaiser from Beulah High School, Abby Johnson from Devils Lake High School, Kanan Ahu Tapi from Bismarck Legacy High School, and Jaden Cherry from Wahpeton High School. So again, great mix of Class B, Class A from across the state. Look forward to hearing your remarks. And again, thank you to Forum Communications for their partnership in helping to make this one-of-a-kind virtual graduation happening, and for streaming the event on all of their newspaper websites, which include the Forum, the Jamestown Sun, the Dickinson Press, and the Grand Forks Herald. I want to also thanks to North Dakota's ABC television affiliates who will be broadcasting this ceremony live again tomorrow at 2 p.m. Central Daylight Time. And we encourage not just the parents and the seniors and the friends and the underclassmen, but we encourage all North Dakotans to join in this virtual graduation as we recognize this incredible senior class, these incredible young North Dakotans for their academic and personal achievements, and as we celebrate along with some of North Dakotans' most recent high school grads, Carson, Josh, and the Tiger Lily sisters, as we help them celebrate to take on their next step in their life's journey. From a gratitude section today, again, as we approach the end of the school year and we wrap up with graduation, we want to just again say back to the more than 10,000 teachers in North Dakota, the 1,000 administrators who swiftly transitioned their learning communities to distance learning, teaching, supporting, and caring for students in new and impactful ways. Also want to give a shout out to all the staff at the school, because whether it was bus drivers that were still delivering meals, the nutrition teams that were still preparing those meals, people that were working on custodial staffs, keeping everything clean. This was a whole of community, whole team effort. And of course, we need to also thank all the parents who took on extra duties in addition to their regular day jobs, supporting those students. And of course, I know personally that there was plenty of older siblings, including some that might have been home, that might have wished they were still in college, that were back home helping their younger siblings with school and helping in that teaching role. So again, thanks to the families for the central role that they've played through all of this. Also want to thank the businesses and communities who stepped up to help support continued learning and fill unexpected gaps for students and families. Like shout out to people like Dakota Carrier Network, who helped to make sure that the identified families in North Dakota that did not have broadband were able to get free cable connections or high-speed connections to allow for distance learning. Others that may have donated devices and helped to make sure that people could get through this unusual time. And again, thousands of caregivers that stepped up, parents, grandparents, uncles, siblings, family, and more, who took this role on as the teaching from home and supporting the students through this whole time. Also want to give a shout out, again, we're talking K-12, but across our 11 universities, all of the same thing there, the staff, the faculty, administration, and the students, incredible job on after spring break to going to distance learning. And again, it wasn't just the seniors. There were 124,070 K-12 students across North Dakota who at each level, whether you're a first grader or a senior, you had to work through change and challenges, and you've remained curious and passionate about learning through this whole thing. And I would say that one thing we know about the students in our state and who represent our future is that they've shown enormous resiliency and innovation. They've continued to learn and they've adapted to the change. And of course, as many adults already knew, many of these young people were actually the real tech leaders in your house, and they have shown the way on how to utilize the technology. So again, as we head into tomorrow to celebrate the end of the school year, we want to say thanks, not just to the graduating seniors, but to everybody in the state who made this amazing spring happen. So congratulations, best wishes for a happy, healthy summer. And I also know that, again, through our earlier executive orders, we've had a reopening under the North Dakota SMART guidelines for access with some of the health restrictions and guidelines to school buildings this summer. We know that summer school is starting, including some in-building activities. And so again, if you are looking forward to catching up or getting ahead, check out your local school district for summer school opportunities and keep your learning going. Next up is behavioral health. And behavioral health today is actually kind of merged with gratitude, and maybe that won't surprise people, but I think that one of the things that you may know is that when we express gratitude, our brain releases dopamine and serotonin. And these are two crucial neurotransmitters that are responsible for our emotions, and it actually makes you feel good. They enhance our mood immediately, making us feel happy from the inside, and that's why they say that gratitude has always been not only good for the receiver, but it's good for the giver. And we all have an opportunity to improve our behavioral health and our mental health by cultivating gratitude. Gratitude takes practice just like any other skill. Getting the discipline to write thank you notes, send a monthly gratitude letter, keep a gratitude journal in a daily way, count your blessings, or in a daily way, practice mindfulness. All of those things are skills that you can turn into habits. Gratitude builds emotional resilience by helping us see the positive things in life. It fights the negative thoughts and rebuilds the optimistic ones, allows us to stay grounded and accepting of the present situation, helps us sustain relationships and appreciate the people who are there for us. And as a result, with gratitude, you can not only love more, but you may feel more loved, more cared for, and more hopeful. You can learn about all these ideas and additional ways to cultivate gratitude at behavioralhealth.nd.gov. And I want to thank our great North Dakota Behavioral Health team, which is part of our Department of Human Services, for providing all these great updates every day. In closing with a quote for the day, Bishop Richard Edgley, who's 84 years old and has a lot of wisdom, says, "Humility and gratitude are the twin characteristics of happiness." What a great quote to go along with the behavioral health, and thanks to the individual that submitted that quote. We'll be back here next Tuesday at 3:30. We'll possibly next week be going to 2 press conferences from 3, or press briefings, as I should say. We'll let you know on Tuesday whether the second one is going to be on Thursday or Friday. Of course, we always reserve the right to add more if conditions arise or emergencies would arise that would cause that, because we want to make sure we're being transparent and available to everyone. But right now we're thinking about 2 next week, the first one being Tuesday at 3:30 p.m., so we'll see you then. At this point, we'll now stand for questions, and again, reminder that Chris Jones is here. Lane?
Governor, I was wondering what your thoughts were on President Trump ending relations with the World Health Organization today.
I guess in preparing for this, I had missed that was happening, and maybe that's what happens when you're head down preparing and focusing on North Dakota. So I'll have to get caught up on that one. Jace, who's not Danny, apparently is relaying the online questions today. Thank you, Jace, for stepping in.
Question from Thomas Simon, Williston Trending Topics. This is actually for Chris Jones.
Okay, great, thank you. Chris?
AARP said in a published report today that the last update on COVID-19 nursing home deaths was May 6th, and this indicates a lack of transparency on the part of the state. Are you prepared to fully update us on nursing home COVID-19 deaths now in the interest of transparency?
Yes, I think before I start, I think if you look across the nation right now, there's a lot of debate and discussion on what should be released. I would say that we don't ask for this type of data from any other setting, and recognizing these are different times, but given that, it's not for a lack of transparency, it's just trying to navigate. But I would like to give an update as of today of the deaths, I can't remember the number of total deaths today. There are 47 that come from nursing homes or long-term care out of a total of approximately 10,000 residents. So it is, while any death is sad, we also know that deaths do often occur in nursing homes, and we've been actively following the number of deaths in prior years in long-term care facilities, and we are no different than we are from the previous year. So at this point, I can't stress enough how important it was that the testing that was being done is allowing us to do the phased reopening that we're doing today, because we have all of this information. The other thing that is not clear, or I should say is still being researched across the country, is we are testing everybody. So people may have COVID who are not necessarily dying from COVID. And that's a difficult thing. Previously we didn't test everybody who died in a nursing home. Now we test everyone. So I think it's important to put that into context of what's actually going on. Thank you.
Wondering if you could just kind of go through the various steps for reopening visitation. Again, I think I missed a few.
Sure. I'll do a high level. So the first step is county by county and the prevalence in that county of COVID. So again, the importance of testing. Secondarily to that is the facility needs to be COVID-free, and there needs to be regular tests. So that, I apologize, I'll back up. The second step is they need to have completed at least 2 tests prior to entering into that first stage. Then they need to continue that serial testing going forward and have no new active residents. They can have active staff, assuming they have all of the other criteria met, meaning PPE, isolation, cohort, or adequate hospital capacity.
And when does in-person visitation open up again, or what does that look like?
So the team that put this together, I mean, this wasn't like picking winners and losers. It was all based on, you know, looking at the research that was available and that we could use. So we didn't like pick the nursing homes first. We said, okay, what is the prevalence that we think we can get comfortable with? What is the rules that we'll follow once we get into that? So what's going on now in this weekend is we are mapping all those counties out, as well as all of the long-term care facilities and where they are in their testing. We anticipate on Monday we'll be getting a number of phone calls. This will be an incentive for long-term care facilities to continue their testing because they would like to open it up. And then we'll make sure that, again, can't stress this enough, the facilities will notify the families because they need to work with the families to schedule, because we don't want everybody to show up on day one.
So what does visitation look like, Chris? Is it, you said it was like outside, social distancing, masks, washing hands, that type of stuff?
Absolutely. And one of the key points is that it is individualized based on the facility. Some will only have visitation to start with outside. Some may just do it inside in common areas. If it's an assisted living facility with separate entries, then they can go into the individual's room. All of these things need to be worked out with the facilities themselves and the VP3 task force.
And Chris, to add on that last point as a message out to the 218 facilities, each of these facilities are going to be required to work on a plan with you. So much like we had with distance learning with each of the schools across the state, all 175 school districts put together a plan. Each facility will work with the VP3 team to come up with a reopening plan that matches their specific facilities. And then one other point of clarification, when Chris said 2 rounds of testing, the good news is we were one of the first states to complete testing at all facilities of all residents, and so that we know the first round is done for everybody. So having the second round is when we talk about having 2 rounds, everybody's at least completed 1 of those 2 rounds already because of the statewide effort. And when we say there can't be any positive residents. If there's a positive residence, then visitation is not going to be happening. He said if you have an active staff, meaning a positive staff, you can have a positive staff get picked up in a test and still have visitation because the staff person won't be there. It's not like once they're positive, then they're going to be isolated for 14 days and they'll be taken out of that work environment. And so it's one of the key gating factors is that all the residents are negative. Okay, online.
All right, this question comes in from April Baumgarten with the forum. April says, I can't recall if Minnesota helps North Dakota with the DAPL protest, but has Governor Walz asked you to help with the Minneapolis protests? And if so, how do you plan to respond to that request?
General Walz has not asked North Dakota. And I guess in the second part of April's question is we'd have to see what the nature of the request is. I wouldn't want to hypothesize about that one. I don't know what the request might be. Other questions? Jack?
These serology testing, deploying them to manufacturing plants and whatnot, is there a starting point where you would first go? Do you have a place in mind, or when that would begin on a large scale?
Well, I think that Dr. Stahl, who will be again taking over on Monday as the interim health officer, has been leading this effort. And the first thing we have to do is get a high level of confidence, because when you've got a finger prick test that comes back in 15 minutes, you know they're not, highly accurate, right? I mean, it depends on if you're trying to do a, when I say not highly accurate, they might be 95% accurate. If they're only 95% accurate and you're testing a population like we are today, where 1.4% of the people are positive, you might be. It may not unless you had a really structured environment, more like I don't want to call it a scientific study to really understand how to use this. So we may go into an environment where we know there have been a high number of positives, where we can identify people who are positive. We'll give them the serology test, which is the finger prick, and we may also, if they're a study participant, also take the full blood draw. So let's say the first 250 people we do in an organized study, you could then say, okay, did the finger prick test show that they had antibodies, and did the blood draw, the more accurate one, that go to the lab? And then we could stand in front of you with a little more confidence that between the machines we have in the lab and the finger prick point of care test, that we would actually know. Because if a person believes they've got the antibodies, then they may feel like, hey, I can't get this again. It's like, then a lot of things happen. You might say, hey, I don't need a vaccine when it comes out. I don't need to be, I'm not going to make anybody else sick because I've already had it. That people could change behavior based on that. So we'd want to make sure that when we have those tests, that those are not just providing peace of mind, but they're actually, that we've got real data. So that's what we want to drive through in the next couple weeks, is what I would call more structured testing, including this dual track group, and then go from there, and then see when we get that, then we'd say, okay, what did we learn? Now we'll do more testing. Then can we deploy it to use it to help us again identify the level of herd immunity we might have. Online, Jace? Okay, for Chris. Welcome back, Chris.
WZFG Radio. Why can the long-term care facilities not have outdoor activities until phase, when outdoor is easiest for social distancing?
So what we're going to look at doing is we want to get people outdoors as soon as possible. And even when you look at the CMS guidance that was out initially, they did not limit outdoor out of the gate. One, we did in North Dakota, more out of just practice, given when the guidance was put out because it was cold out. We will work with facilities to see if we can't do the outdoor visitation earlier on, depending on their unique situation. So we will work with the facilities on that one specifically. It will be different criteria that way.
And we would say that we right now are encouraging, if facilities can get their residents outside right now, separate from visitation, do that. We know that many facilities in our state are adding that back in, and we think that's fantastic. Getting outdoors is really important for people, and would encourage facilities to help their residents get back outside in beautiful North Dakota weather. Okay, we're going to go Dave and then Jacob.
Do you have a rough idea how much this blood test type thing, how much that is going to cost?
I do have a rough idea of the that it was, and I want to make sure I can do the math here quickly in my head, but 178,000 point of care tests, and the total cost was 3.68 million for those, and I'm just going to take a stab and say that's about $21 a test. Someone will have to check my math, but anyway, and again, that is a good price for the time in which we bought them, and the sort of, I call it, in the heat of the battle. It was lower or significantly lower than some of the other The other ones that were on the market at that time, and again, from the early stuff we've done, we're building confidence that the ones we purchased are going to have, this a high enough degree of accuracy to be helpful. But I would like to think that when we get to a future in our state, in our nation, in the world, where this kind of testing is going to be really important to people, is that at volume these tests will start to drop in price, and I would think in the future a time that these would come down to $5 or less. I mean, I've speculated before, that if you think about if you're going to an event, a concert with a $75 ticket or a football game with a $45 ticket, who knows, at some point there, the price of testing may be built into the ticket. And so they've got to come down to a $5, and then maybe someday they're down to less than $1, again, these lateral flow tests. But that's a possibility that they could get that low at mass volume. Jacob?
I'm wondering if there's an update on the relationship with that testing lab in North Carolina.
I don't have any indication other than all of the early stuff we did with them went well, and I think I shared earlier that we got tests back in 33 hours, or the results back in 33 hours from them. That's matches the 24 to 48 hour window that we're trying to do with our own lab, but I don't know, I'm sure we could get it to you next Tuesday or sooner, but we do, how many of the tests went down there as part of that test, of today's record number of tests, some portion of them, I believe, went to the North Carolina lab. Jace, for online?
Gene Shemp with Hometown Radio Group. When it comes to moving to the low level of the North Dakota Smart Restart guidelines, could you speak a little more of why you are comfortable moving the whole state to green instead of parsing out by counties?
Well, for Gene, I guess I would go back to some of the criteria that we talked about early on this thing, which was the sort of the why that we did this, and again, number one was the high rate of testing that we have. I mean, when we're chasing Rhode Island and New York, Rhode Island, number one, CVS is headquartered there. They've been doing large-scale drive-through testing since the very beginning in a state that's got a geography that's not much bigger than Cass County plus a little bit more. And so it's, remember, just for geography, North Dakota is the size almost exactly of all the New England states. So Vermont, New Hampshire, Maine, Connecticut, Massachusetts, and Rhode Island equals North Dakota. So we're trying to deploy, testing over the equivalent of all of those states. So Rhode Island was, from a geographic standpoint, has an advantage, and then they had a corporate partner that was really involved from the get-go. New York received, a ton of federal assistance on testing because they were the epicenter of this crisis. The only state to be, in the top 3 that has not had a huge amount of federal assistance in North Dakota. We're the only one of 3 that's tested more than 9% of our population. So with that, we know that we've got a lot of confidence about that it's not here. If we'd tested I think at the time the White House was talking about they wanted to get everybody above 2%, then they wanted to get everybody of 3%. So in some cases we've tested 2 to 3 times higher percentage of our population. So we've got real confidence about where the virus is and where it isn't. The other piece is, why were we doing all this in the first place? Preserve hospital capacity. We've got enormous hospital capacity. Another way to think of it is we got 98% of our capacity is still available. And then if you said, where is the majority of that hospital capacity? The majority of it is in Cass County. That's where we've got the most number of beds, the most number of ICU beds. And so if that's where we still have a higher number of cases, we still have got great hospital capacity right there close at hand to be able to do that. And then again, numbers have been flat on the 14-day. They're coming down even for Cass County. So again, like I said, was the one we looked at was Cass. We had 20 counties around the state that met all 11 criteria. and 52 met 7 out of the 11. So we feel, and the criteria was quite tight. I would say the one thing, though, we've said, I mean, people probably think this dial only goes one way. If we have an outbreak, if things were to start to heat up, if things were to go the wrong way, then on a county by county basis, we could move back. We could move a county back to yellow from green. So this dial goes both ways, and that's the reason why it's important for us to be thinking about being North Dakota smart. That's why business owners and people that are in, whether you're personal care, restaurant, bar businesses, churches, wherever you're in a position where you've got high concentrations of people that want to have big summer events, if you want to be open and stay open, then do it in a way where you can make sure that an outbreak doesn't occur at your facility or at your venue, because that's the way to stay open. So I would say we had a lot of confidence behind it, but we understand that we're dealing with uncertainty and we're dealing with risk mitigation, and so we're not, we can never have 100% certainty. We have to make decisions on the best data we have, and we have to do it in a way where we're taking on the right amount of risk to manage, again, both lives and livelihoods. And on that balance, we felt comfortable doing the whole state. And then the last thing I'd say is, if you said, hey, we're only going to do the 20 counties that met all 11 gating criteria, we had a checkerboard of transmission going on, because people would have been flocking from yellow counties to green counties, and we probably would have ended up with more of what we don't want, which is a lot of people trying to figure out how to manage around a set of rules or guidelines. So I think, again, us moving together as a state, we can do that together, move together smartly. So anyway, but good question, Gene. Thank you. We put a lot of thought into it. Well, one more question, or you?
Clarification on the number of serology, total number of serology tests that was going to update. It's actually 2,546 is the total.
Is the ones that have already been given?
546, just so.
Okay. 2,546, in case you didn't hear that number before, and that would be up from
Than what the number we have.
because I said 2,632, but it's 2,500. Okay, we're all about precision here, so we've got that one nailed. Okay, good. Okay, one last question.
Governor, in reference to the protests over in Minnesota, you said North Dakota wasn't requested for any specific help, but I'm wondering if you just have a general reaction to what you've been seeing for our neighbors in the East.
Well, it's, what happened in Minneapolis was wrong, and it's tragedy. And it's 2020. I mean, you just hate to see, you'd hate to see that happen any day of the year, having it happening in the middle of this COVID crisis. That's a tragedy. And so, but then in terms of response, I mean, I understand that we've got, a lot of pent up anger and frustration. Some of it that may go back, to the founding of our country. But when we respond by, with criminal activity, riots and looting, fires, I mean, putting more people in danger, that is, I understand there's emotion there, but that also puts lives at risk, and I know that there's going to be, it's going to put tragedy on top of tragedy. Scott Davis, who leads Indian Affairs for North Dakota, his sister lives in that neighborhood, and lives the fourth floor apartment. Her windows were shot out. I mean, she wasn't injured. She works at he's got another friend that works at a place that is involved in Native American activity. They had all kinds of records from the 70s and 80s, historical paper records that didn't exist anyplace else, and that was one of the places that got burned down. So when you're randomly causing this activity, you can, hurt, individuals or people or organizations or groups that perhaps were, collateral damage that didn't need to happen. So I would say again, I know that there's some protests planned one that's being organized for Fargo. And as we've been through we've been through protests before in our state, right when we took office, and we fully support the right of free speech. We support people that want to protest, and we ask dearly that people would protest peacefully, so that they can be, so that they can, honor the memory of those that they're trying to protest for, as opposed to inadvertently creating more tragedy. So again, we will stand with those that are protesting and support their right to protest, but we want to make sure in North Dakota that it remains peaceful. So that's the way to be heard. Okay, with that, I think we're going to wrap. But again, everybody have a great weekend, and thank you for being here. And again, I want to say thanks to all North Dakotans for their incredible work. It's with a great amount of I'd say, positivity and confidence that we move to the green level, to risk level 2, which again gives us a chance to keep taking steps towards more interaction and more activity, more economic activity. But again, as we do that, we want to make sure that we respect, as we do, and are careful about those that are most vulnerable, whether they're people that are in a long-term care facility, and we've also got people that are at risk, that have both age and underlying conditions that aren't in long-term care facilities. So be thoughtful about them if you see them out and about. And again, everybody be North Dakota smart, be safe, and have a great weekend. And thank you. We'll see you on Tuesday.